This is a DVT session of forensic medicine. In next 1 hour, we are going to cover up all the high yield areas of forensic medicine. चलिए start करते हैं. Let's begin from our first topic, जहां पर हम बात करने वाले हैं IPC and CRPC of medico legal importance. Now, बहुत सारा इसमें प्रॉब्लम रहता है स्टूडेंट को कि आईपीसी और सीआरपीसी बेस्ड अगर कोई क्वेश्चन आए तो हम कैसे याद रखें. द फर्स्ट थिंग इज देयर आर सर्टेन आईपीसीज व्हिच यू नीड टू रिमेंबर बाय हार्ट. वो आपको याद रखने ही पड़ेंगे. फॉर एग्जांपल सेक्शन 44 व्हिच इज अ वेरी वेरी इंपॉर्टेंट आईपीसी, डेफिनेशन ऑफ इंजरी. नाउ व्हेन यू वांट टू रिवाइज अबाउट डेफिनेशन ऑफ इंजरी, आपको याद क्या रखना है? 4 चीजें. दैट इट हैज 4 गोल्डन वर्ड्स: बॉडी, माइंड, प्रॉपर्टी, रेपुटेशन. Injury is defined in IPC 44 saying any harm whatsoever given illegally to a person in body, mind, property or reputation. 4 golden words है. ठीक है. Then section 84 हमें किस कॉन्टेक्स्ट में याद रखना है? section 84 IPC मैकनॉटन्स रूल, जो कि इंसैनिटी का डिफेंस है इंडिया में. So legal defense available against insanity in India is मैकनॉटन्स रूल incorporated in section 84 of IPC. Then section 85 and 86 ये ट्विन सेक्शंस है. आप इसको ट्विन सेक्शन की तरह याद रख सकते हो. ट्विन सेक्शन मींस ये आपस में कॉन्ट्राडिक्टिंग बातें करते हैं. व्हाट डज 85 से? 85 टॉक्स अबाउट इनवॉलेंटरी इंटॉक्सिकेशन. ओके, इनवॉलेंटरी इंटॉक्सिकेशन मींस पर्सन इज नॉट रिस्पॉन्सिबल फॉर एनी crime he commits if he has been involuntarily intoxicated. Next is 86 जो कि बात करता है voluntary intoxication. If the person has consumed intoxicating agent voluntarily, then he will be held responsible for whatever actions he do. Got it? Next आता है हमारे पास में section 87 to 92. Now all this sequence 87 to 92 they all talk about consent. So the first thing that you need to remember is 87 to 92 IPCs deal with consent. They all deal with consent. Okay. इन सेक्शन में जो 6 IPCs हैं उसमें से जो 2 हमारे लिए इंपॉर्टेंट है which we need to remember are section 90 IPC which says that anything is not a consent if it is given under fear of misconception, okay, or of a person of unsound mind or somebody who is under the age of 12 years. यानी कि किस कंसेंट को कंसेंट नहीं माना जाएगा? 12 साल से छोटे बच्चे की कंसेंट को वैलिड कंसेंट नहीं माना जाएगा. ये कहां लिखा है? आईपीसी 90 में. एंड देन आईपीसी 92 which is a privilege given to a doctor which says an act done in good faith and for the benefits of a person even without consent is not a crime. So if a doctor operates a person with whom there is nobody available to give consent, if the doctor operates him in good faith, then the doctor is protected under IPC 92. 87 to 92 all deal with consent. Next जो हमारे पास लाइन आ रही है वो आ रही है IPC 191 to IPC 201. They all deal with evidences. Remember IPC 191 to 201 they all deal with evidences. Raghav, yes, I will repeat more of things in English itself. Okay, 191 is a very popular IPC. It deals with definition of perjury. Remember 191 is definition of perjury. 193 is punishment for perjury. Most commonly asked question repeatedly in examination: perjury punishment comes under which section of IPC? The answer is 193, but very less students know that there are 2 kinds of punishments available in section 193 IPC. One, if the false evidence is given at any stage of judicial proceeding, the punishment is 7 years of imprisonment. But if the false statement is given in any stage where a judicial proceeding is not going on, the punishment is up to 3 years of imprisonment. So there is two different kinds of punishment, 7 or 3, depending upon whether judicial proceeding is going on or not. Okay. 197, again, I would say a very important section to remember, because this punishes for issuing of false certificate. A doctor would be punished if he issues a false medical certificate by the law under section 197 of IPC. And then 201 also is an important area to remember. Punishment for causing disappearance of evidence. Anybody who causes any evidence to disappear, he will be punished under section 201 of IPC. Okay, let's move on and now talk about the sequence starting from 299 to 309. This sequence deals with homicide. Remember, 299 to 309, this sequence deal with homicide. Okay, we need to rush fast, guys. I cannot keep back holding on to a slide for long. Don't worry, this section will be available for you on video also. Okay, right now just keep on following my words. Okay, just let the information grab in your brain. 299 to 309 deals with homicide. 299 is definition of culpable homicide. Every sequence, when it starts, the initial few IPCs are all about definitions of the crime it is dealing with. 299 is definition of culpable homicide. 300 is definition of murder. Okay. 302 is punishment for murder, and there are only two punishments available for murder: death or life imprisonment. Fine. 304 is punishment for culpable homicide not amounting to murder. So we can remember something like this. Culpable homicide can be of two types. It could be murder and culpable homicide not amounting to murder. Fine. Murder is punishable under 302. Not amounting to murder is punishable under 304. Got it? 304, the punishment is 10 years of imprisonment. Then 306 is punishment for abetment to suicide. If somebody instigates or abets any other person to commit suicide, the person who abetted the crime, abetment is instigation, he will be provided a punishment of 10 years of imprisonment also. 307 is punishment for attempted murder, again 10 years of imprisonment. And 309, although it is immaterial to us now, but it is of historical importance, because 309 earlier would provide punishment for attempted suicide, which is decriminalized now. So we should remember it that way also. Got it? Next is the sequence which deals with criminal abortion. Very important sequence of IPC dealing with criminal abortion. All the IPCs from section 312 to 316 deal with criminal abortion. Okay. Now, 312 punishes for abortion not done to save life. If a female has gone to a doctor where the female is not threatened with the continuance of pregnancy, still the doctor aborts the female without the timing of the abortion within the jurisdiction of law, it will be a punishable offense under 312. Punishment is 3 years, and if the female is quick with the child, punishment comes to 7 years. Subsequently, you will see 313, abortion without the consent of woman. If a doctor does an abortion without the consent of woman, 10 years. What if the female dies during the process of abortion? 304 punishes for that. If the female dies during the process of miscarriage, punishable for 10 years. And if that miscarriage was conducted even without the consent of woman, it becomes life imprisonment under 314 only. 315, any act done by any person so that it prevents the birth of a live child or cause the child to die after birth, 10 years again. 316, act causing death of a quick unborn child, 10 years. Thing to remember, 312 to 316 deal with criminal abortion. The punishment ranges here are 10 years. So the quick take home message is 10 years related with criminal abortion. Majority of them are 10 years. Okay. Let's move ahead and now see the sequence of hurt. One of the most important sequence. Okay. 319 to 326 and 334 and 335. They all deal with hurt. Okay. 319 and 320 are definitions of hurt and grievous hurt. Quick means, Abdullah, I can see you people are asking what does quick. Quick means if the female has experienced quickening. Okay. Quickening is a process when the female starts to experience the kick of the growing fetus. Quick means quickening. Okay. Movement. Yes. Fetal movement. So 319 and 320, coming back to our present slide, deal with definitions of hurt and grievous hurt. Okay. 323 and 324 are definitions of voluntarily providing hurt and grievous hurt, as you can see in the slide. 325 to 335, which includes 319 and 320 are definitions of hurt and grievous hurt. Then 321 and 322 are concepts which relate to provide information that what will be called as voluntarily causing hurt and grievous hurt. Punishment starts from 323. 323 is punishment of simple hurt. 324, simple hurt but with dangerous weapon. The difference that we need to understand here is, if it is a simple hurt, the punishment is 1 year. But if it is a simple hurt, but that has been provided by a dangerous weapon, punishment goes up to 3 years. That is given in section 324 IPC. Same is for grievous hurt. Grievous hurt is punishable under section 325 IPC. If it is grievous hurt, the punishment is 7 years. But if the grievous had been provided by the use of dangerous weapon, the punishment goes up to 10 years. So punishment increases if the hurt has been provided by a dangerous weapon. Okay. 334 and 335 also provides punishment for providing hurt, but these hurt have been delivered on sudden and grave provocation. What does it mean? That the victim who has received the injury, he gave the assailant a sudden and grave provocation so that assailant had to hit him. So if it is a concept of sudden and grave provocation given by the victim to the assailant, and thus assailant hit the victim and victim suffered a simple injury, the assailant will be punished under 334, where the punishment is up to 1 month of imprisonment only. And if the victim receives grievous hurt, where the victim has given sudden and grave provocation to the assailant, the assailant will be punished under section 335, where the punishment is up to 4 years of imprisonment. So often we receive a question in the examination where the hurt received by the victim is either simple or grievous. That's understandable. Okay. But then somewhere in the question it is also written that victim had given a sudden and grave provocation to the assailant. Now what will be the punishment? So if sudden and grave provocation was given by the victim to the assailant, punishments are lesser as compared to voluntarily providing hurt. Okay. So we need to keep a track about that simple concept while reading the question. Furthermore, we tackle some more important CRPCs also. So important CRPCs for us to remember are section 39 CRPC, which says every person is bound to inform commission of any offense which is listed in the section. Okay, so in section 39 CRPC, there are a lot of offenses which are listed. Okay, and if any person gets any idea about that offense being committed or being planned, it is his duty to inform. In those list of offenses, 302 and 304 are included. Okay, remember that. Section 53, very, very important. An arrested person can be medically forcefully examined if the request has been forwarded by a sub-inspector. Okay, so it is an important thing to remember. Anybody who has been arrested, he can be forcefully medically examined by the doctor. Similarly, section 53A of CRPC, this provision is specifically for rape accused. If a rape accused has been arrested, he can also be forcefully medically examined. Forcefully means without the consent. Okay. Then section 54 of CRPC, 54 CRPC says a person who has been arrested can ask for self-medical examination in front of magistrate. So anybody who has been arrested and police has been denying any kind of medical examination to that person, but the person wants to be medically examined, he can ask for self-medical examination. The magistrate will grant him. This provision is given in section 54 of CRPC. Then we have section 164A of CRPC. 164A of CRPC is examination of rape victim. So whatever provisions of examination of rape victim are given, that are given in section 164A of CRPC. Okay. Next, section 174 CRPC, one of the most common, one of the most popular section that we deal in the first page of our forensic medicine book itself. Police inquest. 174 defines police inquest. 176 defines magistrate inquest. Okay, these are the only two inquests available in India. Okay, only two inquests that are currently running in India are police inquest and magistrate inquest under section 174 and section 176. Then 357C CRPC, 357, all hospitals, government or private, to provide first aid and treatment to an alleged rape victim and mandatorily report it to police. Remember, this is very, very important. 357C CRPC, mandatory reporting to police. So nobody can maintain a doctor-patient privilege here. If there is an suspicion that there could be a rape victim, doctor has to report it to police. And then lastly, 114 Indian Evidence Act, 114 IEA. This says presumption of consent of rape. If a female says she did not consent for sexual activity, then court has to believe that. She does not have to prove it. If the female goes to the court and she says that a particular person had sexual intercourse with her and she did not consent, the female does not need to bring a proof that she did not consent. 114A Indian Evidence Act says the court has to believe that she is saying truth. Okay, so these are some very, very important CRPCs and IPCs and IEA which are asked in the examination. Go through them, try and remember them all. Okay. Now, the second area, which again is very, very inherent to forensic medicine and very important for examination, are post-mortem changes. The first thing that we are going to talk about post-mortem changes is the concept of cadaveric spasm. As we all know, cadaveric spasm is an alternative or alteration or similar looking situation to rigor mortis. Okay, rigor mortis, the basic aspect is depletion of ATP. Cadaveric spasm is a condition where there is complete lot of ATP from a muscle group just before death. So consider a muscle group losing all its ATP just before death. So what will happen? As the person will die, that muscle group will straight away start to show rigidity because all ATP has been lost. That condition is called as cadaveric spasm. So that muscle group will remain in a state of contraction post death. Remaining muscles of the body will pursue the normal rigor mortis cycle. Cadaveric spasm never happens in all the muscles of the body. It only happens in a specific muscle group. Most common muscle group is hand or upper limb. You can see the cadaveric spasm developing in the photograph here. Okay. Thing to remember about cadaveric spasm. Second is post-mortem hypostasis. Look at the picture here. Post-mortem hypostasis. All this red discoloration is post-mortem hypostasis. Post-mortem hypostasis is called by many synonymous names. Lividity, livor mortis, sugillation, vibices, darkening of death. All are names for post-mortem hypostasis. Medico-legal importance of understanding post-mortem hypostasis. It tells us about position of body after death. Why? Because post-mortem hypostasis develops in the dependent portion of the body. Second, it can tell us about time since death. How? By a concept called as fixation of post-mortem hypostasis. After the DVD class, when you will be getting the brainstorming question, there is a question there regarding fixation of post-mortem hypostasis. I will talk about the medico-legal importance of fixation there. Right now, remember, there is a concept called as fixation of post-mortem hypostasis. And third is cause of death can be told by post-mortem hypostasis also, only in certain situations where the color of the post-mortem staining is different. So we need to go through variety of colors of post-mortem staining. Okay, just remember that in few poisonings, the color of the post-mortem staining is different. Like in carbon monoxide poisoning, it is cherry red. In opioid poisoning, it is black. In cases of perchlorate and nitrate poisoning, it is chocolate in color. Like there are variations of color, so it can give us a clue about the cause of death. Now, focus on this graph here. Very, very important graph. If you can remember this graph, you can remember everything that happens around in post-mortem changes. There are 4 curves which are showing in this graph. The first curve, which is in brown color here, which I am marking right now, it is a sigmoidal shaped curve. This curve belongs to post-mortem cooling, or you can say it belongs to algor mortis. Okay, look at the shape of the curve. It is sigmoid. So at 0 hours, the temperature of the body are high, and as the hours proceed, the temperature drops. So sigmoidal shaped curve belongs to post-mortem cooling. Then second curve is this red curve here, which is a parabola. Parabola curve belongs to rigor mortis. Look at how rigor mortis increases over a period of time. First of all, it does not start right after the death. See, rigor mortis starts to happen somewhere here, few hours after death. Okay, then it reaches the peak and then it comes down. It comes down here. Okay, rigor mortis, parabola. Third is this dotted line, blue in color. This shows post-mortem staining. Post-mortem staining. Again, this post-mortem staining also does not start to begin right after death. It takes few hours for post-mortem staining to shows up, and it never comes down really because it merges with the decomposing body. And fourth, this linear accelerating curve is nothing but decomposition. And decomposition, normally body decomposes by the virtue of putrefaction. So it starts pretty late, 18 to 20 hours after death, and it keeps on decomposing more and more as the time elapses. So it is always a linear accelerating curve going upwards all the time. Okay, great. Now look at this photograph here. This photograph is showing a very important phenomena in post-mortem changes. This phenomena has been asked in the recent examination with good quality question. This phenomena is called as marbling. Marbling is a process where there is greenish blue discoloration of the vascular epithelium due to reduction of hemoglobin to sulf-methemoglobin. Okay. Remember this photograph. In last two examination, two separate questions have been asked about marbling. Okay. In both the examinations, photographs were shown, and in one examination it was asked that what is the postmortem change. In the second examination it was asked that this postmortem change is due to what substance. The substance is reduced hemoglobin, sulf-methemoglobin. Okay. Let's move on to the next set of pictures here. Look at these three set of pictures, all showing decomposition of human body after death. The first picture is putrefaction. Remember, no preservation of body and foul smell. No preservation of body of any kind and foul smell. Second picture is of adipocere. Injuries better preserved. Remember, adipocere injuries are better preserved. So there is good or better preservation. Smell is sweet. Okay. Third picture is mummification. Best preservation. No smell. Best preservation, no smell. Okay. The variations that come in their decompositions that are available, and we have talked about it earlier. Okay, so I am sure that you know in what climate what happens. Now this is the sequence in which organs putrefy. Okay, now when we look at this sequence, the first thing that you need to remember, because whatever happens first, we need to remember larynx and trachea, they start to putrefy at the earliest. But after that, you will see that there are host of body organs that putrefy, and the sequence is S, L, B, H, K. Spleen, lungs, brain, heart, kidney. Okay, remember S, L, B, H, K. Spleen, lung, brain, heart, kidney. Once larynx, then spleen, lung, brain, heart, kidney. Fine. And the last two organs are uterus and prostate from female and male. Okay, uterus and prostate. Last in female is uterus, last in male is prostate. But in between S, L, B, H, K. Remember Casper's dictum, very important. Casper's dictum when we talk about body decomposition. A body decomposes in air twice as rapidly as in water, and 8 times as rapidly as earth. So if we talk about the body decomposition in earth in comparison to water, in comparison to below the earth, is 1:2:8. Okay. So fastest decomposition happens in air when the body is above the earth, then slower in water, slowest when the body is buried under the earth. Okay. And then also questions are asked in putrefaction delay factors. Putrefactions are delayed in death due to wasting diseases like anemia. Okay. And then certain poisonings. These are important poisons. Okay. Remember them. Carbolic acid, zinc, strychnine, and chronic heavy metal poison like arsenic. They delay putrefactive changes in the body. Carbolic acid, zinc, chloride, strychnine, and heavy metal chronic poisoning. Got it? Okay. Very favorite area if it comes to AIIMS examination. Now we can say INICET. Okay. Asphyxia. Okay. Remember, when we talk about asphyxia, we have to talk about two situations: hanging and strangulation. The first thing is hanging. Hanging happens in two forms. It could be complete or partial. We all know that. Complete is when the body is swinging in the air. Partial when the body part is touching the ground. So there is some partial weight bearing. Now when there is some partial weight bearing by the feet itself, then what provides the counter traction for the ligature material to constrict the neck? The counter traction in partial is head weight. If anybody asks you that what is the counter traction in cases of partial hanging, in majority cases the weight of the head itself provides the counter traction for the constriction of ligature material. Okay, and then hanging can also be distinguished in typical versus atypical format. Look at picture number 1 here. This is typical hanging, not at the back. This is typical hanging. And picture number 2, 3, 4, where the knot of the hanging ligature is not at the back, it is on the sides or on the front of the neck. All are atypical. Okay. Second, specifically I have added this photograph here because what I've seen over a period of time in the past is AIIMS based examination. They love to show the photographs of throttling, manual compression of neck. Look at this photograph. This photograph shows throttling, hands pressing the neck. These circular lesions are called as 6 penny bruises caused by the pulp of the pressing finger on the neck. Okay, very important to recognize throttling, manual, strangulation. Remember, strangulations are of 5 types: ligature, manual called as throttling, Barnes-Dole, mugging and garroting. Okay, Barnes-Dole, mugging and garroting. Coming on to drowning, yet another interesting area when we talk about asphyxia. So the first two things that you remember about drowning is not indicator of ante-mortem drowning. Washerwoman hands or feet, they are not an indicator of ante-mortem drowning. You kill a body, throw the body into water, washerwoman hands and feet will still develop. And second is cutis anserina. It happens in post-mortem drowning also. So they are not indicators of ante-mortem drowning. So what are indicators of ante-mortem drowning? The indicators of ante-mortem drowning are grossly 3. Very important. Number 1, cadaveric spasm of drowning, the hand, the fist clenched. Number 2, frothing, very important. And number 3, diatoms in bone marrow. These 3 are very important indicators or realistic indicators of ante-mortem drowning. Okay, very good. Soumya is asking a question. drowning occurs in well, whether it comes under fresh water or salt water. That's our next talk, Soumya. Just focus, okay? Now, the drowning that we are talking about here, the drowning can be of two types, okay? Focus on the slide right now. This drowning can be of two types. It could be either a fresh water drowning or a salt water drowning. For all practical purposes, remember, salt water drowning is sea water, rest everything is fresh water, okay? Now, what pathophysiological changes does it bring to us, whether it is salt water or sea water drowning? Fresh water drowning, the water which is entering into the alveoli, because whatever water will be inhaled by the person, it will terminally reach alveoli. That will be hypotonic in comparison to the blood in blood vessel, which will be comparatively hypertonic. As a result, the tonicity gradient will be created between vessel and the alveolar membrane, and water will flow from hypotonic segment to hypertonic segment to maintain isotonicity. In this process, there will be hemodilution, cellular rupture, because when the blood will be diluted with lot of water, cells will rupture because they will swell up and rupture. Hyponatremia, and because of the cellular rupture there will be hyperkalemia. Okay, so this will be found in freshwater drowning. On the other hand, what will be seen in salt water drowning? The water which is reaching the alveolus is hypertonic as compared to blood, which is comparatively hypotonic. Tonicity gradient reverses, so more water will leave blood vessel to reach into the alveolus, that is lung. As a result, the circulation will be concentrated with hypernatremia. So the findings are going to be different. In freshwater drowning, hyponatremia with hyperkalemia. In salt water drowning, it is going to be hypernatremia. Okay. Okay. Let's move on to our next topic. Again, very interesting and an important one, identification. Now, many of students faces certain problems in identification because lots of indices are given. Indices are basically bony calculations which are utilized to distinguish or to identify either race or sex or stature. So what I've done is I have made this table for you. In this table, there are important indices written which often are asked in the examination in a categorical form. For example, when we talk about race, the indices which determine race that you need to remember are cephalic index and long bone ratios. Long bone ratios, brachial index, crural index, intermembral index. Okay, so these bony indices, they identify race. Okay, when it comes to sex, ischiopubic index, alar index, sacral index, mandibular canine index, footprint ratio, costal cartilage calcification pattern, Hertel's law, Ashley's rule, all these indices are helpful in determination of sex. Stature, Karl Pearson's index, also known as Karl Pearson's formula, or Glessner and Trotter index, also known as Glessner or Trotter formula. Okay, so what my recommendation is, remember cephalic index, long bone ratios, because they talk about race, Karl Pearson's index and Glessner and Trotter index or formulas, because they talk about stature. Rest everything is an index which is used for determination or distinguishment of sex. Okay, so use this as an elimination. If you remember what talks about race, if you remember what talks about stature, then rest every ratio is talking about sex. Okay, use it as an elimination. Something more about identification of bones. Second is important differences between male and female pelvis. Now there are many important differences between male and female pelvis. In last 3 years, twice the question has been asked from this area. It is a very important area also. Why? Because pelvis is the single most important bone which can distinguish sex. The accuracy of pelvis is 95%. So even if we have single pelvis available, the accuracy with which we can say whether it is male or female is 95%, which is high accuracy. Okay. Remember, when we talk about male bones, often the things are large or bigger. So remember, anything which is large or bigger is going to go with male bone unless and until there is an exception. For example, you will see acetabulum, male bone large. Okay. Obturator foramen, main bone large. But when we say greater sciatic notch, male bone is not large. It is rather narrow and deep. In female bones, it is wide and shallow. So anything which is wide, we often consider it as large. Okay. So what I'm saying is, greater sciatic notch in males will be something like this. It will be narrow, but it will be deep. The depth will be greater. And in females, it will be like this. It will be wide, but it will be shallow. The depth will be lesser. So you can say one thing which is not large in males is greater sciatic notch. That's all. Subpubic angle is V-shaped. Preauricular sulcus is not found in male pelvis. Remember, it's a very important difference. Very less times it has been asked in the examination. Preauricular sulcus is a constant feature in female bone. Okay. And ischial tuberosities are inverted and everted in male versus female. Kuch cheezein, some things are going to be like which you need to mug up and remember. But otherwise, keep this concept alive in your mind. Large, bigger goes with male bones primarily, unless and until there is an exception. Okay. Some more thing about identification, particularly this slide has been included after last year's INI-CET examination. This is something that you need to remember. Fingerprints. Fingerprints are the most important identifying parameter because fingerprints are unique to every individual. They never change in life. They are different in identical twins also. Identical twins may have same DNA, but their fingerprints are going to be different. So that's the importance of understanding fingerprinting. They are most unique identifying parameter. Okay. Now fingerprints sometimes can change either permanently or transiently. So let's see what are the changes that can come about in fingerprints due to certain conditions or diseases. Permanent damage to fingerprints can happen in leprosy, radiation or electrocution. Okay. Distance between the ridges of fingerprints can change, but the pattern will be the same if there is acromegaly. Okay. Ridges itself will alter in cases of skin diseases like scleroderma, eczema, acanthosis nigricans, and loss of pattern with ridge atrophy. Ridge will also atrophy and there will be loss of pattern also in cases of celiac diseases. Okay. So my advice is, remember this slide as it is. It was asked in this year's examination itself. High probability part of it may be asked in next examination. Okay. Coming on to the most green area of forensic medicine, injuries. Now one portion of injury which is very consistently being asked in the examination is incised looking lacerated wound. Okay. Incised looking lacerated wounds are wounds which are delivered onto the skin on bony prominences by blunt weapon, because blunt weapons produce lacerations. But why do they look like incision? Because when the blunt weapon hit our skin, which is in proximity with the bone, the skin in that area gets crushed between the two blunt weapons, blunt objects. One is the hitting blunt weapon from the top, one is the bone from the base, and thus the skin splits open. So it is a split variety of laceration, and whenever this phenomena happen, you can see in this photograph, the margins are very regular. Margins are regular, and when the margins are regular, it may look like an incision, and that is why they are called as incised looking lacerated wound. Okay, remember that. Now there is a converse terminology also. The converse terminology is called as lacerated looking incised wound. Primarily it is an incised wound, but it looks like a laceration. Why? Because it has been given on the areas of body having multiple skin folds or abundance of connective tissue. So if you make a cut on the armpit, that is axilla, or on scrotum, or on gluteal folds where there are skin folds, even that incision may have irregular margins, so it may look like a laceration. That's called as lacerated looking incised wound. So there are two kinds of variety: incised looking laceration wound present on bony prominences, the injury is given by blunt weapon, and lacerated looking incised wound present on skin folds areas given by sharp weapon. Okay. Another thing to understand is lines of Langer. Lines of Langer is a concept which says determining gaping in penetrating wounds of the body. So cuts or stabs onto the body, how much do they spread up after cutting, how much the area gape, that depends upon lines of Langer on the body. If the lines of Langer are cut perpendicular, the gaping will be more. If the lines of Langer are cut parallel, the gaping will be less. Remember, perpendicular, if lines of Langer are like this, and if you give a cut perpendicular, the gaping will be more. Like this. But if you would have cut the area parallel, the gaping would have been less. So remember, parallel cutting, gaping less, perpendicular, gaping more. Road traffic accident injury. I would actually ask you to take a photograph of this slide right now. Okay. This table shows us the kind of injury which will be suffered by the passengers of a car if a car meets with road traffic accident. Now, this tells us that there are three quality of passengers: driver, front rider, back seat rider in a car. If the car meets with an accident and all three of them die, how can we identify which could have been the driver or which could have been the person who may be sitting in front with the driver, or the person may be sitting at the back? By looking at these specific injury on their body. Seat belt injury, driver will have it, yes, but the seat belt injury contusion will go from right shoulder to left groin in the driver. We are right-handed sided drive country. Front rider, yes, seat belt injury will be seen on his body also, but going from left shoulder to right groin. Pillion rider, no, because they don't wear seat belts in our country. Dashboard injury, driver will have, front rider will have, pillion rider won't have it. Steering wheel injury, only driver will have it. No other person will have steering wheel injury if it is present, because there is only one steering wheel in the car. Whiplash effect, driver will have it, front passenger will have it. The reason for whiplash effect in their necks is their bodies are restrained by seat belts. So two people sitting in the front portion of the car, their bodies are restrained by seat belt. They will have whiplash effect in their neck. Person sitting at the back probably will not have whiplash effect in his neck. Windscreen effect. When the windscreen will break, it will hit the exposed portion, face and neck of the people who are sitting in the front. So windscreen injuries, driver will have it, front passenger will have it, but posterior passenger will not have it. So person sitting at the back will not have any of the 5 injuries. Person sitting in the front alongside with the driver will have 4 of the 5 injuries. He will not have steering wheel impact. The only difference is his seat belt contusion will go from right to left side. Driver seat belt contusion will go from right shoulder to left side. Okay, very informative table. Okay, let's move on and now talk about certain important areas in toxicology. Okay, one very important preventive measure that we talk about in toxicology is gastric lavage. So very often students talk about gastric lavage karna hai, nahi karna hai, hota hai, nahi hota hai. The thing to remember is what is utilized to do gastric lavage. The answer is Ewald's tube, not Ryle's tube. Gastric lavage tube is Ewald's tube. Photograph number 1 shows you Ewald's tube. It's a tube which is used for gastric lavage. Its standard length is 1.5 meter. Okay. The only absolute contraindication for gastric lavage is sulfuric acid poisoning. Fine. And remember 2 very special lavages because they are antidotal in acute poisoning. Freshly prepared hydrated ferric oxide solution, lavage with it in acute arsenic poisoning, antidotal lavage. Second, copper sulfate solution, lavage in cases of inorganic phosphorus poisoning. Very important lavages to remember. Fine. Then look at photograph number 2 here. I have specifically added this photograph because this is a contrasting phenomena that we see in one of the corrosive poisoning. The corrosive poisoning is called as carbolic acid. Carbolic acid ingestion contrary to other corrosive ingestions do not cause thinning of the stomach mucosa. It rather causes thickening of the stomach mucosa. The stomach wall is thickened, called as leathery stomach appearance. Look at the thickened stomach rugosities in the photograph. The medico-legal importance of this knowledge is because the stomach wall is thickened, you can do gastric lavage or activated charcoal therapy in carbolic acid poisoning. So approach to treatment is different. Okay, in contrast to sulfuric acid where gastric lavage is absolutely contraindicated. Now look at the photographs of these some seeds and plants and fruits of medical legal importance. The first one is Abrus precatorius. You can never miss this particular seed. Typical red color seeds, also called as Ratti Gunchi Jagriti seeds. Sorry, not sweets. Ratti Gunchi or Jagriti case seeds. They have an active principle called as abrin. The active principle is abrin. Abrus, abrin. The medico-legal importance is making of sui. In olden times, a device called as sui was made from their concoctions, which used to be stabbed into the bodies of victims, and then that sui would go inside and do the potential damage, even kill the victim, like that. Second is seed of Nux vomica. In normal colloquial language, it is called as Cuchilla. Remember, Cuchilla is Nux vomica. Medico-legal importance is it produces typical postures while the person is experiencing convulsions because its active principle is strychnine. Strychnine is a spinal poison. It causes convulsions. The typical postures are opisthotonus, pleuristhiotonus, and prosthiotonus. Okay. The most common posture which is seen in strychnine poisoning is opisthotonus, most commonly seen during convulsive phenomena. Third is, have a look what is called as poppy capsule. This is where we get poppy, a fiend in Hindi. Okay. Medical legal importance of understanding this capsule is longitudinal incisions are to be given on unripe capsule for the opium collection. Okay, as you can see in the photograph, longitudinal incisions are given and this drop which is coming out is the latex opium. Okay, now this opium contains morphine in ranges of 9 to 14%. Fine, but the medicinal morphine that we get in our drug pharmacy, that is 10% morphine. So what happens is, whole collection of morphine goes to government laboratory where the standard for 10% morphine is available. The morphine is extracted from that crude opium and then it is standardized as per the standard which is available in the government laboratory. Only the morphine which comes out from that government laboratory after extraction from opium and getting standardized as per the standard which is only available in government laboratory in Ghazipur is called as standardized morphine. So remember, what is standardized morphine? Standardized morphine is 10% morphine prepared in government laboratory only. Okay. Then see this plant, cannabis plant. The active principle is tetrahydrocannabinol, commonly called as THC. Okay. Medical legal importance is, this plant gives us 3 products of recreation: bhang, ganja, charas. Bhang comes from leaves. You dry the leaves and crush them, becomes bhang. Ganja comes from flowers of the plant. Charas comes from the stem. The most potent product that we obtain from cannabis is charas. The least potent is bhang. So THC concentration has to be highest in charas or hashish. It has to be lowest in bhang. Okay, that's how we understand the concepts. Something more from toxicology. Okay, we see these flowers. These are flowers of medico-legal interest 1 and 2. Both the flowers, they are kind of purplish in looking, but their designs are different. Flower number 1, you can see it's a bell-shaped flower. You can see clearly, it looks like a bell. Bell-shaped flower belong to Dhatura plant. Okay, belongs to Dhatura plant. So any question showing you a bell-shaped flower, they come in 2 variety, white or purple. Think about Dhatura. Okay. Second is purple color flowers as seen in photograph number 2. Okay. They are aconite flower. Aconite, also called as wolf's bane or meetha zahar. Purple color flower. In an examination, these flowers were given and you were supposed to recognize the poison and then answer the question based upon that poison itself. Remember, aconite, purple color flower, not bell-shaped flower. Okay. Most toxic part of aconite plant are roots. These are roots of aconite. Photograph number 3. Go and have a look of roots of aconite also. Okay. So you should be able to distinguish all these facts. Roots of aconite, most poisonous part of the plant, purple color flower of the plant, aconite. Bell-shaped flower, white or purple in color, belongs to Dhatura. Now, this slide again is slide of medical legal importance. This slide talks about differences that are we going to see in common presentation of patient under substance intoxication when they arrive in hospital emergency. Okay, so we are talking about a person under substance intoxication coming to hospital emergency. What should be his basic presentation? Cocaine. People come with increased heart rate, chest pain, kind of MI kind of symptoms, okay, coronary spasm, cocaine की वजह से. BP is increased, respiratory rate is increased. Increased temperature, hyperthermia caused by cocaine. Later on, all parameters are depressed. So generally when people come, they come in a stage of acute intoxication because they are experiencing some problem this time when they had the dosage of cocaine. They come with these parameters, increased. Later on it decreases. Cannabis, normally people don't come to hospital because it is not an agent which is going to cause a lot of problems to a person. Okay, tolerance with cannabis is high, deaths do not happen. But still, if a question is based, increased heart rate, lower blood pressure, normal to increased respiratory rate with cannabis, but then people generally talk about high appetite. This is called as munchies. The munchies people, okay, they want to munch something all the time. Third is opioid. With opioid poisoning, decreased heart rate, lower BP and depression of respiration. So everything decreased, opioid. Everything increased, cocaine. In between cannabis, but remember cannabis people generally do not come to emergencies, does not cause acute problems. Okay. Now let's talk few words about thermal injury. Again a very important table coming up with distinguishing clinical situations in 3 thermal heat phenomena. First is heat cramps. Body temperature in heat cramps may be normal to increased. Sweating is present, pupils are dilated. If the person progresses from heat cramps, he will progress to heat exhaustion. Body temperature definitely increased. The skin is still moist, sweating was there, but it is gradually going off. So skin is still moist in heat exhaustion. He complains of acute thirst. Then heat stroke. Heat stroke can primarily develop on its own if a person is in high temperature, or it could be a progression of sequence of heat exhaustion. Temperatures of the body are very, very high. The important thing is sweating is absent. Sweating is absent. Okay. Pupils now become contracted. To start with, the pupils were dilated. At the end, the pupils are contracted. Remember this table because this concept of clinical presentation has been quite often asked in the question, that a person was doing certain work, he collapsed, he has been brought to hospital, this is the clinical condition, what is the situation? More often than not, they want to ask you about heat stroke. Remember, so most commonly the parameters given are this and this. Okay. Second, when we talk about heat or temperature, remember an important finding called as heat ruptures when bodies burn. Heat ruptures are due to prolonged burning of a body, most commonly seen in thighs, calves, joints or extensor surfaces of the body. They need to be differentiated from incised or lacerated wound on the body, because if you look at the picture, these are heat ruptures where I'm drawing arrows, you can see. Okay. Now if I don't tell you that these are heat ruptures, they look like a lacerated wound on the top half of the body or on the surface of the body. So how do we differentiate? Lacerated wound is an antemortem phenomena, heat ruptures are post-mortem phenomena. Differences can happen in variety of situations, but 2 important differences are intact vessels and nerves in the bed of heat rupture. Okay. Second is coagulated blood in the intact vessel, which is called as segmental clotting of intact blood vessel, which is the single most important distinguishing phenomena. It has heat rupture. So intact blood vessel and nerves in the bed goes in favor of heat rupture. Coagulated blood here and there in the intact vessel called as segmental clotting in an intact vessel goes with heat rupture. Firearms. When we talk about firearms, Remember, when we discharge a weapon, a bullet comes out, but along with bullet, there are few more physical parameters that come out. Flame, smoke, gunpowder. Flame, if it impacts the person, is going to produce burning or singeing. Smoke, blackening. Gunpowder particles, tattooing. Okay, so if tattooing is present, it means gunpowder particulate matters have been able to reach the body. If blackening is present, it means smoke was able to reach the body. If burning or singeing of the area is present, it means flame reached the body. Now, how do we tell what could have been the distance? This chart tells us, this table tells us, distant range. The fire has been made from a lot of distance. The shape of the wound will be circular, corresponding to the size of the bullet. There will be abrasion collar and grease collar which are produced at the entry wound due to the bullet entering the body. So they are bullet phenomena. Abrasion collar and grease collar are bullet phenomena. And no tattooing. Nothing else will be present. Only abrasion collar and grease collar. Distant range. Bullet बहुत दूर से आया है. Second is intermediate range. Again, the shape and the size of the entry wound remain similar to the distant range, but now tattooing around the wound is present. Tattooing present means intermediate range. Close range, shape becomes big, concentric and big, size become big, shape becomes concentric. Abrasion collar, grease collar, burning, blackening, tattooing, everything is present. Now burning, blackening, tattooing, all three are present, but they are present around the entry wound. Okay. Contact, shape is biggest, size is biggest, shape is stellate. Burning, blackening, tattooing are present but not around the wound, inside the track. It becomes contact. Okay. So distant, only entry wound present, nothing else. Intermediate, along with entry wound, tattooing present. Close, entry wound large, burning, blackening also present along with tattooing, but all three present around the wound. Contact, shape and size are largest, burning, blackening, tattooing present inside the track. So depending upon what do we get at the time of autopsy, we can comment on the distance from which the fire has been made. Some more things about firearms, some important bullet names and bullet parameters. Remember them. Dum-dum bullet, a bullet which has notch in the center, it produces more damage. Okay. Tandem bullet or piggyback bullet, one behind the other, because the previous bullet was stuck. So the person, when he fired the second bullet, the stuck bullet which was already stuck in the barrel, it also got pushed along. So single fire, two bullets coming out, one behind the other, called as tandem bullet. We do all these things in our usual lecture when we do a longish lecture, but right now I am telling you these independent questions are also asked. What are tandem bullet? What are dum-dum bullets? Remember, yawning bullet, the bullet which has lost all its kinetic energy. Okay. Tumbling bullet, a bullet which is tumbling towards the target because the caliber of the rifle is big, the bullet is small. So when it comes out with force, it starts to tremble in the barrel, and then when it goes out, starts to tumble towards the target. Ricochet bullet changes direction because it hits something in the midway. Okay, and then Kennedy phenomena associated with bullet wounds. Surgical artifact, when the surgeon opens up the track to save a person who has been shot, the entry wound and the exit wound both becomes large, and if the person subsequently dies, it becomes difficult to tell which was entry, which was exit, because the surgeon, in an attempt to save his life, opened the track. That is called as Kennedy phenomena. It creates an artifact and difficulty in identifying entry or exit. Last two slides, guys. Last two slides. Just be with me. Autopsy procedure. Some very important points to remember about autopsies. 1. Skin incisions. Basic skin incisions to open up the body. I-shaped, Y-shaped, modified Y-shaped. Modified Y-shaped is best for neck dissection. Neck dissection, use modified Y-shape. Okay. Second, neck to be dissected last in neck compression death. So anybody asking you a question that in cases of hanging, strangulation, what needs to be opened last? The answer is neck. Okay. Infant autopsy, abdomen needs to be opened first. Okay. Normally abdomen is not opened first in adult autopsy. In adult autopsy, the best approach, if you do not know the cause of death, is to open the head first. Okay. Then thorax and then abdomen. Infant autopsy, abdomen has to be opened first because we need to see that level of diaphragm. Okay. Then evisceration technique. Once you have opened up the body, you take the viscera out to have a look at the visceras. Rokitansky in situ organ dissection. Organs are not taken out. Individual organ is cut inside the body only, and that's how it is seen. Virchow's, one by one, whatever organ of interest you want to see, take that organ out of the body. Left lung taken out, dissected, seen, put back, then right lung taken out one by one. Virchow's technique. Luteal, which is also called as en-masse technique. All the organs of the body from head, that is from oral cavity, not head, from orocervical trunk to genitourinary trunk, all the organ content of the body is taken out of the body cavity as a single mass by cutting everything from its posterior body attachment. This technique is called as luteal. And then Ghon's technique, which is called as en bloc. Body organs are taken as 4 separate blocks. Orocervical block separately, cardiopulmonary block separately, gastrointestinal block separately, genitourinary block separately. This block separate technique is called as Ghon's technique. Then common preservatives. What are some important common preservatives which are used in dissection room of autopsies? If you need to preserve viscera for toxicological determination, any poison, whether it is present inside the body or not, the preservative is saturated solution of common salt. Very important information, very commonly asked questions also. Viscera is preserved in what? Saturated solution of common salt. But if the viscera has to be preserved for sulfuric acid poisoning, where do we preserve? What do we use? Rectified spirit. Sulfuric acid poisoning, rectified spirit. Okay. Tissue for histopathology, 10% formalin. Urine, we preserve in thymol. Blood and vitreous humor, we preserved in sodium fluoride. Okay. Very important again. Blood and vitreous humor, sodium fluoride. Injection prick skin site, we preserved in normal saline. Normal saline, injection prick skin site. Some important preservatives used in dissection room of the autopsy center on daily basis. Last slide containing some miscellaneous information. Remember something about leading question, very important area, have been asked in recent 2-3 years examination. Leading questions can be asked to a witness during, most importantly, cross examination, but also during examination in chief if the witness turns hostile. Okay, if the witness turns hostile, leading questions can be asked to them as well. Note, judge can ask a question to a witness anytime during witnessing, anytime. Okay. Now, cases when it comes for trial in the court, they can be of two types: summons cases, warrant cases. The difference is all IPCs where the punishment is less than 2 years, they are dealt in the court of law as summons cases, and those where the punishment is more than 2 years dealt in the court of law as warrant cases. Got it? Medical negligence can be of two types. Civil, the issue is monetary compensation. Okay. Criminal, state punishing a doctor for negligence under section 304A. Remember this. Contributory negligence is a concept where negligence contributed by the patient along with the doctor. In contributory negligence, it's not that doctor is not negligent. Patient contributes to the negligence of the doctor. Contributory negligence can be used as defense by the doctor in civil negligence cases. to decrease the liability of compensation payment. But contributory negligence cannot be used as a defense in criminal negligence cases, because availability of something called as doctrine of last chance. Doctrine of last chance, just remember, doctrine of last chance is a doctrine which is available in the courts of law, which prohibits the use of contributory negligence as a defense in criminal negligences by the doctor. And lastly, a word called as lucid interval. Lucid interval is the name given to a time period when symptoms disappear temporarily. It can happen in insanity and EDH. Okay, so when a person who has suffered an injury, his symptoms disappear temporarily, he is in lucid interval. The compression effect of EDH has gone for certain amount of time, only for that compressive effect to come back. And similarly, in insanity, a person suddenly starts to behave normal, not insane. He may be in lucid interval. These are some very, very important points to remember. These are high yielding areas which have been asked in examination, quite repeatedly in last many years. Okay, go through them. Don't leave these topics when you are revising. Bye. I hope it's time for your last session, I guess, for DBT. I'll see you soon somewhere later while we discuss the brainstorming MCQ. Bye for now. Bye.